Okay guys, so we're going to go over rubber dams and how to place one on. Let's go over a couple of the materials that you'll need for rubber dam. The first one being the latex itself, which is just a piece of stretchy latex. We do have some that come in non-latex, so this is one that we're using now. Latex is honestly better because it stretches and it doesn't tear as easy, but we do have non-latex. This is the box that it'll come in, and you'll see that says non-latex. So this is what we're using today, but if you have a doctor who likes to use latex, you have to check their each patient to make sure you're using non-latex if they are allergic. Okay, so this is the rubber dam material itself. This is a clamp, rubber dam clamp. So the tooth is going to kind of go in the middle like this. I've also tied a little piece of floss to it. We call this a ligature. What it does is, just for example, if I put it in the patient's mouth here, and for whatever reason it falls out, I can still use this, to avoid it going down the throat. Okay, so this is again the rubber dam clamp. This is just one. This is a molar clamp, and there are other kinds, but this is just the one we're going to use today. Then you also have a hole punch. This is a hole punch. What you do is you put the material in here, and then you close it, and it punches a hole in it, and we'll use that in a little later. We also have what we call crown and bridge scissors. You will need scissors. So these are some crown and bridge scissors. They're pretty thick scissors. And we'll use those here shortly, but they're just scissors. Okay. And then another thing you need is forceps. Now forceps come a little different. A forceps is any instrument that opens and closes. So you'll see this opens and closes. This actually has a lock on it. This is a lock. So if I want to this to stay open here, I can move this up and it'll stay open. It won't come off. So this is just a lock, that goes up and down, and you keep it there and it'll hold there. So the forceps is meant to go into the little holes in the clamp. So you put one in each, and then when you squeeze it, it opens and closes. Right? So this is how you squeeze it to get it on the tooth, and then close it around the tooth. Right? So this is one type of forceps that you can use, and it'll look like this. Another type of forceps that you can use looks fairly similar. It just has more rounded tips on the bottom here. Same concept. When you squeeze it, you push this lock up and it locks it open, or you can close it. So either one of these are fine. It just really depends on what you feel is necessary. The other thing you're going to need is to actually tear off or cut a little piece off of this, just the corner. So I've already done one here. So we'll use this a little bit later, but you just need a tiny little piece separate that looks like this. Okay, so that's the only other thing you need is a frame. This is a frame. And what this does is it actually holds the material. So you'll see these little spikes on the ends here. Right? Those spikes are what actually you kind of stretch this material on and holds it in place. And I'll show you how to use that. This is one of the last things you do. So that's your frame there. Another thing that's really helpful for you to have during rubber dam is called a mouth prop, or a bite block. What this does is it goes to the side that you're not working on. So if I'm working on this side of the mouth, I'm going to put it over here, and then the patient bites down on it or rest, because this procedure they have to stay open the whole time. So it just gives them something kind of just to rest down on. So you can see that there. Okay, so that's always very, very helpful to have with this procedure, because it is fairly long. Okay, all right, so let's go ahead and get started. So the first thing is your rubber dam material is going to come blank. 9 times out of 10, there's going to be nothing on it. It's just going to be blank like this, nothing on it. Now you can buy a stamp, and It's literally an ink pad, and then you put the stamp on it, and then you stamp down on here. That gives you kind of an outline of the teeth. So you can see I've kind of done that here. This is what your outline will look like. It's going to literally be dots, and that is it. So you're going to have to know what those dots mean. Now I took one and I drew on it so I can kind of give you an idea of what those dots mean. So you'll see that you have the maxillary here, mandibular is here. You have the quadrants, upper right, upper left, lower right, lower left. And I kind of outline the teeth a little bit so you can kind of see these are teeth. You will not get this if you have the stamp. It's going to look like the little dots. That's all it's going to look like. But you need to know that this is kind of what you're imagining when looking at them. Okay. So this is the little dots. Let me turn this around. Here we go. So on here, this is the maxillary, this is the mandibular, and you can see that the general arch of the teeth themselves. So let's say today we are going to work on number 3. Okay, so this we'll put this over here so you guys can reference it. So we're going to use number 3 today as an example, and the maxillary tends to be a little harder than the mandibular, but I'm going to show you guys little easier ways of doing it. So the first thing we need to do is, once we have our latex, is that we need to punch a hole for this tooth. So the whole point of this rubber dam is to stretch it around the tooth to create an isolation so that nothing can get on the tooth, or like the materials we're going to use, and then also saliva. So what we're going to do is we're going to put the clamp on the tooth like this. But I need to have really good access to this tooth, and with all this metal around the tooth, it seems to be a little hard. So what we're going to do instead is you're actually going to clamp number 2, and that'll leave number 3 to be able to easily accessible for the doctor to do whatever the filling or root canal or whatever we're doing. It's just a little easier for you guys to use it. So you always want to clamp the tooth behind it. Some people clamp and punch holes for the whole arch. Some of them do just for the quad. Some of them do just 2 teeth ahead, 2 teeth below. It just really depends on what your preference is. But they're really, necessity-wise, is going to be to clamp the tooth behind it and then the actual tooth you're using. Today what we're going to do is do 2 teeth in front of it and then the tooth behind it as well. So what we're going to do is punch a hole in here, okay? So we're going to get our hole puncher out. Now you'll see that the hole puncher has different sizes on it. You have the larger size over here, and then they kind of get smaller and smaller as they go around. Personally, I don't ever use that big hole punch because I don't want this to be loose. I want it to be tight. So if anything, I want to do it just a tiny bit smaller than the tooth rather than bigger. So the hole punch I normally use is actually the one next to it for a molar. The premolars tend to be a little smaller, so then I kind of go to the next tooth. And then if it's a maxillary incisor, those are a lot bigger. I'll use this one. And then if it's a mandibular incisor, those teeth tend to be a lot smaller, so then I use the smallest, babyest little one there. But that's just, really any hole will work. It's just you don't want to punch it too small, and then when you stretch it, it breaks. But you also don't want it to be too big to where it's not tight around the tooth. So you'll learn these pretty easily and which ones you like more than the others. But we do need to punch a hole for each one of them. So what I'm going to do is, since number 3 is a molar, I'm going to turn this not to the big one, but to the second biggest one. And then that way when I close down on it, it'll punch that hole. So you're just going to take your material through here and find that dot, right? And then you're going to squeeze. Now, what I like to do is I like to push the material all the way up, make sure that the hole went all the way through. And then I let go. And then I go to the next one. So I need to punch the tooth behind it. So I'm going to make sure the hole went through all the way. All right, now the number 4 I know is a premolar, so I'm going to turn and do the next smallest hole punch. All right, so now if you look at it, you'll see that I have 4 holes punched total. So we have the one that we're going to be working on is number 3, but we're going to place our clamp, the one behind it, and then I have 2 teeth in front of it as well. Again, you could do the whole arch or whole quad if you want. You could do more teeth. It really depends on you and the doctor and what's going on. But for this, I'm just going to do 4 so I can kind of demonstrate for you. Okay, now there's 2 different ways to do a rubber dam. There's a more advanced way, and then there's the way it was designed to work. So I'm going to show you both of them. But for now, I'm going to pull the lips back so you guys can see better. But generally, you would want to be, aware at least. So this is the maxillary, okay, and we're going to work on tooth number 3. Which is right here, right? So what I'm going to do is I'm going to place the clamp on the tooth behind it, which is tooth number 2. Now you'll see that this patient actually has some stuff in between the teeth. And so what you're going to want to do is actually floss that out ahead of time. So that it doesn't interfere with you later. So let me get some floss real quick because you're going to need to floss in between these teeth. So let's get all that out. That'll make your job much harder. All right, that'll work. Okay, so now we're going to place the clamp itself. So we're going to take our forceps and the clamp. So you're going to place those into the holes, and then you're going to squeeze and then lock it open so that you don't have to struggle. One less thing to do, so just lock it, and then you're going to place it around the tooth like this, gentle, and then you're going to let the lock go and let it close down, and then you're going to release. So when you do this, you want the teeth to be going like at the gum line, but not on top of the gums. You want it to go on top of the tooth itself. So you'll see how it's not digging into the gums. All right. You also want your floss to go on the sides of the mouth. If he had lips, it would kind of come off to the side like this. But again, that's kind of like your emergency, to grab that. Okay. All right. So next thing we're going to do is we're going to take our rubber dam material that we used, and we are going to stretch it and place it around the clamp. Now you need to be very gentle. You can't just stretch it and do whatever you want, because it's going to rip, and if it rips, that means moisture is going to get in and defeats the whole purpose of this. Okay, so you want to make sure that you do the clamp first, and then we'll do the surrounding teeth. So what I'm going to do is I'm going to place it around this back part, this little hump here, this ring, and then I'm going to slowly bring it around the sides to prevent it from breaking. Okay, so again, we're going to stretch it gently. There we go. All right, and then I like to take some sort of instrument. It doesn't really matter what instrument you use. Use something to help pull this around the clamps. It's just a lot easier than using your fingers, especially so far back in the mouth on number 3. You want to try and, not, shove your whole hand in their mouth. So I'm going to bring this around the clamp all the way, one at a time. Here we go. Good. So you'll see that there is kind of like a space. I'm not sure if you can see, but you can kind of see there's a space right here. You want to kind of pick this material up and you want to like catch it or try to push it down there, because I want to create a barrier. I don't want there to be a space to where things can get in. So you want to kind of just tuck that in a little bit. All right, so now you can also see the holes that we made and see how they align with the teeth. That's perfect. It's exactly what we want, okay? So now what you're going to do is you're going to take that little piece of material that you cut off earlier, and the easiest way to do this is to actually take this and floss it in between the teeth to kind of create a little stopper, right? Sometimes you'll have to really stretch it around the tooth a little bit first, like this, and then take it and push it down. So now it kind of holds it in place for you so that you can take your instrument again and kind of get this position around the teeth itself. Okay, so you want to again just gently stretch this around the tooth as best you can. All right, then you're going to take some floss. One piece of floss. Here we go. And you're going to push the material down. Sometimes you have to floss it a couple times to get the material all the way down. All right, and then you're going to floss this side as well. So you want to kind of move it around. It's harder to floss right next to the clamp, but it is something that you want to at least floss a couple times to try and get this material down around the tooth. All right. So we'll maneuver it a little bit, take some floss, and push that material down. There we go. Okay, so next we're going to do the next tooth. So kind of grab it around the tooth here, floss the material down. There we go. And then you want to take your widget out and floss with this floss. There we go. So it's forcing the material down there in between. And then you want to go back in with this as well. And oops, see, it broke. So all you're going to do is just cut off a little corner. Now you can buy these like pre-made. They're called widgets if you want, but this is just a way to save money and not have to buy something else. And basically it's just a stopper that keeps the material from coming back up, because what's going to happen is there's going to be saliva underneath here that's going to try and creep up a little bit. So we want to try to avoid that as much as possible. Okay, so the next thing we're going to do is we're going to place our frame on. Now the frame has kind of a bend to it, so you can see how it kind of smiles a little bit here. This goes around the chin of the patient and it's going to match their chin. Okay, so you want this bend to bend out towards their face, not in towards their face. So you're just going to take the material and stretch it and allow it to come and lock into the little spikes here and here. And you'll see that this actually creates a really good tight fit. See, it's not sitting around the teeth anymore. It's really tight. So now when the patient closes, so I'll close it so you guys can see what it would look like on a real patient, it kind of goes around their face. Does everyone see that? This is what it will look like. Okay, now if you can imagine, their nose is right here, and this is going to get really cumbersome for a patient. So what I always recommend doing is taking some scissors and cutting a hole for their nose so that this isn't resting on their nose. Can you imagine how much that would itch and how much that would bother you? So I always cut a hole for their nose, right like this. The other thing is that we want to prevent the patient from biting down, because it will break the clamp off. So you want to use your bite block, and behind here, it sits into the teeth like this, and it keeps their mouth open so it doesn't stretch. And then let me put the lips back on so you can kind of see what it looks like with the lips. All right, so you'll see that it can be very cumbersome for the patient. If you look at it on the side, see it's stretching their lips quite a bit on both sides here. But the bite block that's behind their cheek is actually helping them stay open, which is the biggest thing that you want. Now, what is the point of this, right? So the whole point of this is to make sure that the field is clean, because what the doctor is going to do is they're going to go in and let me cut that so you guys can see better. There we go. So now when the doctor comes in with their drill, they're going to drill on this tooth, right? They're going to do their thing. The water is going to fall out, but none of the water or the saliva from, behind here where their tongue is and all that stuff is going to be able to get the tooth wet. It keeps their tongue back. Their tongue can't get in the way anymore. Their lip can't get in the way anymore. This completely isolates the tooth, which is the whole point of this, is that we can make sure that nothing touches the tooth. The other thing is that when we do a root canal, for example, what we're going to do is we're going to drill in here and we're going to remove the nerve of the tooth. And when it's removed, we have to make sure everything is removed. So what we do is we literally put bleach in the tooth. What the bleach does is it kills anything left behind that we couldn't see, the microscopic stuff that you can't see with your eyes, right? So I don't want that bleach to get inside their mouth. I don't. So this prevents that bleach from getting inside their mouth, but safely using it in the tooth like it's intended to. Now, obviously, we don't tell them it's bleach. If your doctor says sodium hypochlorite, he means bleach. But that is one of the materials that we use to clean the roots out inside the tooth. So it's preventing this stuff from the saliva coming onto the tooth, and also prevents what we're going to put on the tooth going into the mouth. Okay. Now, the other thing I want to mention is that when you're suctioning, you're going to use your HVE suction, which looks like this. You're going to want to kind of push down on this material and force, let gravity work for you. So allow the water to fall into the suction itself instead of being right next to it. I mean, yes, you can be right next to it and you want to, but you can also, use this to your advantage, that everything's going to fall. So you can kind of push and create a direction for the liquids to go. Now, it's really easy to only focus on this, but you have to remember they're still producing saliva. They are, they can't close their mouth. Their mouth could be filling up with saliva in the back there. So you still want to use your saliva ejector, and I bend it like this because the bite block is actually intended to hold the saliva ejector. If you put this in the middle like this, it will actually hold the saliva ejector and clean out that saliva, and you won't have to worry about it one bit. So that will stay in the mouth the entire procedure and suck up any saliva that they produce. And then your job now, you don't have to worry about that anymore. Your job is just to focus on this, and cleaning up all of the water that we're spraying on the tooth and any cleaning supplies that we put on the tooth. Okay. This is the rubber dam and how you put it on. Again, this is the frame. This is the clamp. This is the rubber dam material. And you're going to clamp the tooth behind the one we're working on. So we are working on this one with the blue dot on it, number 3. Clamp behind it if at all possible. If you're working on the tooth that is the last tooth in the mouth, you have to clamp it. But ideally, we don't want to. You want to give, the tooth behind it that opportunity to do that. Okay. All right. So this is one way to put it on. To take it off, what you're going to do is you're going to first take out your stopper here. right? So take that out. You can pull the material up if you want, but it tends to feel weird for the patient, and you're, tugging on it a lot and, stuff like that. So what I like to do is just take my forceps and leave all this on, and then I squeeze, and then I take all of it off at one time, because there's nothing forcing it or keeping it on anymore. And you're just going to pull it out of the spaces between the teeth now, and it'll come out, and this is what it will look like. And you'll see that it teared a little bit when I just took it out, but for the most part our holes are still really good. They don't have any tears, and it did really good while it was in the mouth, which is the whole point, right? So I told you earlier that there's another way to place the rubber dam, and it's a little more advanced, but another way you can do it is to put all of this on just like this, right? And then put your clamp into the rubber dam at one time, all right? So you're going to do this outside the mouth. You're going to, let's see, I'll do the other one since I ripped it. You're going to gently place the clamp around the teeth like so. And then these wings are really great for this specific thing. So you kind of put it on like that, and then you take everything all at one time to the patient's mouth, and then clamp the tooth this way. Then let go. Then you're going to stretch the material and floss in between, and everything is the same. It's a little more cumbersome if you've never used this before to do it that way. So I do recommend doing the clamp first, then putting this on, especially when you first start out. And then when you get a little better at it, then you can try and do it all by yourself, all at one time. But that's just another way of putting it on. So you may see somebody do it that way. Okay. All right. So this is a rubber dam, and how you put it on and take it off. If you have any questions, just let me know. Otherwise, have a great day.